We've talked a lot about adult hospice on this channel, but we really haven't looked at children's hospices and how they differ, which they do in many distinct ways. No one likes to think of sick kids, they say it's unfair, but the natural world, including biology, doesn't care about fair, and ignoring the issue doesn't make it go away. Before we begin, we post death and dying related videos every Friday, so if that sounds like your kind of thing, consider subscribing to the channel. Now let's talk the differences between adults and kids hospice. Hospice means many things. In some countries, hospice refers to home or community hospice, where a hospice nurse comes out to your home. For others, it refers to an actual facility, such as a separate building on a hospital campus. For this video, hospice refers to an actual facility or building rather than a service that takes place at home. Additionally, sometimes adult hospices do take under 18s where there's no children's hospice remotely close, but it's rare, and usually if there is no children's hospice for a terminally ill child, they will stay in the paediatric wing of a hospital. So with those things cleared up, let's take a look. Locations and building. Typically, an adult hospice is a standalone facility and located on hospital grounds. Some are in urban areas, other regional, aiming to serve a wider catchment area because the need is high. Children's hospices, on the other hand, are fewer in numbers and often positioned regionally, as children needed palliative care is rarer and highly specialised services are concentrated. Therefore, families may need to travel further, but this is accommodated for with children's hospices usually having accommodations for families, which we'll come back to in a bit. An adult hospice building is usually quiet, calm, and designed to provide dignity, privacy, and comfort in end of life. They often resemble small hospitals, but with a more home-like atmosphere. Children's hospices, on the other hand, are more playful and family-orientated. They are usually bright, colourful, and equipped with playrooms, sensory rooms, gardens, and spaces for siblings. They try to normalise childhood experiences alongside medical care. Medical care and choice. In an adult hospice, care focuses mainly on pain and symptom management, emotional support, spiritual care, and helping the person die with dignity. Stays are often shorter, perhaps a few weeks or months, as admission usually happens close to death. This is where the two differ quite a lot. Care in children's hospice usually begins from diagnosis of the life-limiting illness, sometimes years before death. They provide respite stays to reduce carer burnout, as well as therapies, educational support, and sibling care alongside end-of-life support. The approach is less about imminent death and more about improving quality of life throughout a child's illness. Which brings us to the concept of self-determination and autonomy. In an adult hospice, the adult patient is the primary decision maker about their treatment, advanced care plans, and end-of-life wishes, unless they lack capacity. But of course, depending on their age, many children won't have capacity. So in a children's hospice, parents and guardians are the legal decision makers, but children's voices are included when appropriate. The balance between parental choice and respecting a child's developing autonomy is a delicate ethical issue. Certainly there is a big difference in the ability to understand medical treatment between a 4-year-old and a 14-year-old. And of course, here in Australia, anyone under 18 cannot access VAD, even though it has been noticed that terminally ill children, particularly teenagers, would like that choice. Family involvement. In an adult hospice, families are supported, but the central focus is on the adult patient. Visiting hours are often flexible, but overnight stays for relatives are very limited. Staff focus is on the patient and their wishes. On the other hand, in a children's hospice, families are deeply integrated. Parents may stay overnight, often in specially built accommodations on site. Siblings have dedicated support, and whole family care is emphasised, including bereavement follow-up for years. Staff and training. In an adult hospice, staff are trained in palliative medicine, nursing, counselling, and spiritual support, usually with a focus on adult conditions like cancer, organ failure, or dementia. In a children's hospital, staff require specialist paediatric palliative care training. They handle rare genetic, metabolic, and neurological disorders, which are often much more complicated to manage. Simultaneously, staff also provide developmental, play, and educational support. Psychosocial support. In adult hospice, the emphasis of psychological support is on existential issues, grief, dignity, and closure. Children's hospices use play, art, music, and sensory therapies to help a child express themselves and experience joy despite illness. There is also significant support for parents and siblings in navigating complex emotions, anticipatory grief, and trauma. Community role. Adult hospices have strong links with home-based palliative care, outreach nurses, general practitioners, and often local spiritual leaders. In a children's hospital, it's much more diverse. They work closely with schools, disability services, and paediatric hospitals, ensuring continuity of education and development. Now, some people might ask, why would you put a terminally ill child in school? Schooling implies a future, which is a very shallow way of thinking about things. Not doing so would imply that a child should just be waiting around to die rather than experiencing the life they have left. And schooling provides socialization, friendships, inclusion, and mental stimulation. Also, many people often assume, for some reason, that terminally ill kids are mostly intellectually delayed, which is far from the truth. Most have all their cognitive and intellectual faculties intact. They know what is going on, and they have the same needs as any other child. For some, their only day-to-day symptom in the early stages is that they get tired easily, but they still want to go ride their bike, play video games, and hang out with their mates just like any other kid. Let us know in the comments, did you know about children's hospices and how they worked? Are you surprised by the differences? Children's hospices aren't all that commonplace because thankfully not as many kids are terminally ill compared to adults. But they do exist and they need to exist. Medicine doesn't fix everything and medicine doesn't catch everything. The diagnoses that many terminally ill kids have are often very different from what you would see in an adult's hospice, and kids require a different environment in this situation compared to adults, and that's okay. And with that, go talk death.